Well, now that we have a clear understanding that we both need both initiation as well as promotion to cause cancer, you're probably wondering, well, who are the three suspects? You only talked about two things. Well, we're going to keep that for a surprise. We're going to give another example of initiation and promotion. So theoretically, a carcinogen, uh, because of its or the metabolic activation of it, may bind to DNA, and if it does, the DNA is repaired, it'll be a normal cell. If it's not repaired, it may die. If the carcinogen is detoxified, it'll never bind to the DNA, will it? If the cell does not die, and if it is not repaired, remember we talked about cancer as being non-lethal damage, it may result in a permanent DNA mutation or lesion in an initiated cell. This is the process of initiation. Now that cell is promoted or multiplied by the process of promotion to be a pre-neoplastic clone. There may be further proliferation. Promoters are proliferators. There may be additional mutations, but at some point in time, there may be a malignant neoplastic cell, and that's going to be the cell which gives rise to the entire tumor, perhaps ultimately weighing several pounds. Okay, so I know you're still excited about who are the three suspects. Here we have a Kevin Spacey movie called The Usual Suspects, and the reason why I like to talk about the three usual suspects is because they are always mentioned on the list when you talk about inflammation or teratogenesis, immune suppression, general mutations, or neoplasia. And we all know what they are because we ran through them several times already. The three usual suspects for carcinogens are chemicals, radiation, and infectious pathogens. And in the case of cancer, it's usually viral infectious pathogens. These are the categories of carcinogens. These are the initiators. The carcinogens may work absolutely directly by virtue of their chemical structure, or these initiator carcinogens may be metabolized in the body to be carcinogenic. So you might want to make that distinction. Dimethyl sulfate, diepoxybutane, beta-propiolactone, these are all absolutely direct initiators. You put them on cells, they will initiate the cancer. Almost everything, almost all of the chemotherapy drugs, especially things like cyclophosphamide and chlorambucils, and the nitrosurias, these are also carcinogenic in themselves as well. Acylating agents such as 1-acetyl-imidazole, dimethyl carbamyl chloride, these are all direct initiators as well. The indirect ones can be called procarcinogens because they have to be metabolized by the body before they could do their work. And believe it or not, the category of things we call TARs, or the aromatic hydrocarbons, all those polycyclic, heterocyclic aromatic hydrocompounds, these are not direct, they're indirect. They're metabolized by the body, as well as the aromatic amines, the amides, the azodies. These are also procarcinogens as well. Normal organic compounds like aflatoxin causing hepatomas. Griseofulvin, an antifungal, which is used as sometimes an anti-tumor agent itself, also is a procarcinogen. Interestingly, there's a compound called cycocin, which you might guess are from cycads, you know, those bugs. They can be metabolized as well and have been indicted as carcinogens. Safroles from sassafras, betel nuts, well known to cause oral squamous cell carcinomas. See, I had a little mistake there. I should have said SCC rather than BCC. These are all procarcinogens or carcinogens that have to be metabolized before they can be initiators. Let's look at another class of initiators. Uh, we know that nitrosamines, from nitrites and tars and amides are also in that category. Vinyl chloride doesn't easily fit into that category. Oh, they noticed that in a Goodyear rubber company in Kentucky, uh, people that worked there were developing angiosarcomas. They traced it down to vinyl chloride. Many of the elements, the metals on the periodic table, nickel, chromium, absolutely known carcinogens, uh, insecticides, fungicides, and of course the PCBs, which are blamed on destroying the environment and causing global warming. They also are indicted in causing cancer as well. If we go to the second part of carcinogenesis now, after the initiation of tumors, we have to talk about the factors which proliferate the cells after they have been uh, in the transformation phase. And some of those, the biggest category of those are regular hormones. Hormones multiply cells, especially the steroid hormones. They act directly on the nucleus to cause cell proliferation as part of their normal job. So they can also act on cells that have been initiated as well. And promotion can only take place after initiation. A family of compounds called 4-ball esters, or TPAs, these also are known as promoters. Phenols, many drugs. And remember, initiated cells respond and proliferate faster to promoters than normal cells. So these promoters are going to be acting with much greater effectiveness on cells that have already been initiated rather than non-neoplastic cells. The second biggest suspect is radiation. This is the second usual suspect. Both ultraviolet, part of the normal sun spectrum, has been indicted in all of the three common types of skin cancers: basal cell, squamous cell, malignant melanoma, as well as the higher energy ionizing radiation. Both photons, which is non-particulate, as well as particulate, beta particles, protons, alpha particles. These are all things which have been known to cause mutations resulting in malignancies. As many as 90% of the people exposed to I-131 after a fallout, in fallout victims in Hiroshima, developed thyroid tumors within 15 years. And for some reason, ionizing radiation seems to affect more the hematopoietic tumors, cause hematopoietic tumors like lymphomas and leukemias rather than non-hematopoietic tumors. It seems like the non-hematopoietic tumors are either less susceptible to radiation or require a longer latency period. And of course, we normally think of skin cancers as being in older people, but you can see skin cancers, especially basal cell cancers, in young patients. Perhaps have been radiated for lymphomas, developing basal cell cancers in the skin in the area of radiation. So radiation carcinogenesis is a well-known fact, and it's the second of the three usual suspects. The third one are viruses, or I should probably better say pathogens of all types. But if you take the HPV virus, which is redundant, a human papillomavirus, that's been indicted in a wide variety of both benign and malignant squamous proliferations in areas wherever there is squamous epithelium. EBV, the Epstein-Barr virus, same virus that causes mono, that genome is present in 100% of patients with Burkitt lymphomas. HBV, the regular old hepatitis B virus, predisposes to hepatoma or hepatocellular carcinoma, the same term. HTLV, or human T lymphocyte virus 1, predisposes to a wide variety of T cell malignancies. If you remember, it was HTVL3 that wound up being called HIV ultimately. And of course, Kaposi sarcoma is a sarcoma present in patients with AIDS, but it's caused by a different virus. It's caused by the Kaposi's sarcoma herpes virus. So these are all well-known, proven connections between specific viruses and specific cancers, and I thank you very much.